The risk for a second heart attack after having a first really depends on how well you control the disease process. That's really important to understand. If someone continues to smoke or eat poorly or not take the medications that they need to improve their risk, they probably will return with some type of heart problem in the future. In order to reduce your risk of having a second heart attack, you need to play an active role in improving your risk factors. So we can improve our diet, we can work on increasing exercise, stopping smoking if you're a smoker, working on stress, and make sure to take your medications. This is a simple thing, but missing doses of medications can also leave you at risk. Smoking specifically is one of the worst risk factors for heart disease and can accelerate disease far greater than what you would have had if you were not a smoker. You should know your numbers for heart disease. Know your cholesterol number, your blood pressure, your sugar, your weight, and work with your doctor to make sure that those numbers get to the most optimal levels they can get to reduce your risk. Another factor that is often missed in patients in terms of their risk is something called lipoprotein A. And this is a cholesterol marker that leads to plaque, but it also increases your risk of clotting. So there are some factors that are genetic and you may be born with that lead to your risk of having further disease. But the reality is that the bulk of the disease that we're seeing in this country is secondary to our poor lifestyle. So everyone should know their risk for heart disease. The earlier we address this process, the better you will do in the long run.